Good morning, everyone. This is Minerva Noor, and I'm doing a assessment of the postpartum client. This is our client. This is Miss Minnie Mouse, and we're talking about postpartum. Postpartum is the time between delivery and the return of the reproductive system. So it's a pre-pregnancy state. You will assess the client's vital signs: breast, fundus, bladder, lochia, perineum, legs, and any incisions. So first, we need to check Miss Minnie's vital signs. Measure vital signs with the frequencies specified by facility policy or according to the provider's prescriptions. Include temperature, pulse, respirations, blood pressure, and oxygen saturation, as well as the client's pain level. Temperature may rise due to the dehydration that can be accompany labor and sometimes as a result of epidural anesthesia. After the first 24-hour, however, elevations in the temperature warrant further investigation as they suggest infection. Pulse rates may be somewhat elevated but should return to their pre-pregnancy status gradually. A sustained rapid pulse can indicate hemorrhage. Respiratory rates may be low after epidural anesthesia and after cesarean birth, but should gradually return to the expected range. Monitor oxygen saturation to assist in determining if the client is experiencing respiratory complication. Orthostatic hypotension is common after delivery. Hypotension can indicate hemorrhage, and hypertension may persist in clients who had preeclampsia. So, and then we're gonna assess the client's pain, including the location, the type, quality, and the severity. And then administered pain medication to keep the client's pain at a manageable level. For perineal pain, apply cold during the first 24-hour, and then including cool seats baths. These help reduce swelling and irritation. After the first 24-hour, warm is helpful for promoting circulation and healing. To help reduce pain from sitting down, suggest that the client compress or tighten their buttocks just before sitting. This reduces pressure to healing perineal issues. And then after that, we need to assess their breasts, inspect and gently palpate for the redness, pain, or engorgement. Inspect the nipples for redness, cracks, and bleeding. If the client is breastfeeding, their breasts are engorged. Suggest a warm compress or a warm shower before breastfeeding to stimulate milk flow. Or if the newborn isn't emptying both breasts, suggest client pump their breasts to relieve discomfort. If the client is not breastfeeding, suggest ice packs to help suppress milk production and reduce discomfort. And then we need to assess the fundus. So just gonna change this and to this. So we need to check the fundus. First encourage the client to urinate prior to the assessment. Assess them in the supine position. Assess uterine height, location, and consistency, determining the fundal height by placing one hand to the base of the uterus and the other to the umbilicus. So measure how many finger breadths and the other and you can place between the fundus and the umbilicus after above or below it. If none, then the fundus of the umbilical level at a 12-hour delivery, the fundus is typically 1 cm above the umbilicus, but this varies. The uterus descends in the pelvis approximately 1 to 2 cm per day, about 1 week after delivery. The fundus should be halfway between the umbilicus and the symphysis pubis. So this is the symphysis pubis and this is the umbilicus. And then also assess the fundus is baggy or firm. If the fundus is baggy, gently massage the uterus by rotating motion. Yes, you have to massage the uterus by rotating motion while supporting the lower segment until it feels firm. Without stabilization of the lower segment, the uterus could invert and severe hemorrhaging could result. And then we need to assess the bladder and palpate the bladder at this time as well. Determine whether the fundus is at the midline, in the pelvis, or displaced laterally due to a full bladder. If the bladder is full, encourage the client to urinate and monitor their fluid intake and output. For some clients, insertion of a straight urinary catheter may become necessary. And then we need to examine the lochia. Excuse me. Examine the client's perineal pad for bleeding, noticing the character, the quantity, the presence of the clots, and odor. Lochia rubra is a typical 1 to 3 days following delivery, and small clots are common. Determine the amount of saturation as scant, light, moderately heavy, or excessive. And then check the client's buttocks to be sure blood is not pooling beneath them. Lochia typically increase with with breastfeeding and ambulation. If bleeding is excessive, the client will soak an entire perineal pad within 15 minutes or so. For what finding numerous large clots or a foul odor, notify the provider immediately. And then we also need to check incision. If the client has a cesarean delivery, examine the incision for redness, edema, ecchymosis, drainage, and approximation of its edge. If the client has an episiotomy, have them lie on their side and assess the episiotomy incision for approximation, edema, and ecchymosis. Also check the rectum for hemorrhage and assess bowel function by auscultating bowel sounds. And then assess for thrombophlebitis by checking the client's calves for pain, tenderness, or redness. Notify the provider immediately if you find any of this. Check for edema of the hands, face, and the lower extremities. And then finally, assess the client's comfort level and emotional status. And thank you for listening.